For decades, the suicide rates of military veterans has steadily increased year over year. When Jeffrey Howard looked into the data for a 2023 paper, he knew how the numbers had been trending, but he wasn't prepared for how dramatic the trends had become.
We had a sense that the veteran cohort would be higher than the total U.S. population and that the TBI group would have the highest. So we kind of expected that, but we didn't really expect the steepness of the increase over time. So that was surprising and kind of alarming to us.
Howard is a professor of public health at the University of Texas at San Antonio.
That's a very steep upward curve. From 2011 to 2020, that decreased a little bit. It went down to about a little over 5.5% per year increase, but still increasing at a pretty rapid pace.
For veterans with a traumatic brain injury, Howard discovered that the average percent increase in the suicide rate was a little more than 7.5% each year between 2006 and 2011. Howard revisited this research for a collaborative study between the Department of Defense and the Department of Veteran Affairs. The 2025 paper in JAMA Network Open has revealed a shocking new trend. Across the board, military suicides have seen a big drop after 2020.
Honestly, I thought it would just kind of be continuing. And so when we saw the reversal, we were actually very excited to see that. I've done quite a bit of work in studying trends over time of different kinds of things like this. And honestly, I don't think I've ever seen a reversal or a change that has been so dramatic. From 2020 to 2022, it decreased by 12% per year for those 2 years. So it's a very strong change in direction with pretty large magnitude. 12% a year, that's over 2 years, that's about 25% roughly decrease.
These numbers are specifically for the veterans with traumatic brain injuries, which means the group with the highest rate has seen the most dramatic drop in suicides.
For the veterans without TBI, the rate of increase per year from 2006 to 2011 was a little under 5% per year, 4.85. And then from 2011 to 2020, it dropped a little bit to 3.41% per year. Still increasing. That's still a pretty large increase per year. And then from 2020 to 2022, the decrease was a little over 7.5% per year.
Though not as large a decrease as the veterans with TBI, Howard says it's still a huge difference seen in just a couple of years. And while this trend is proof that the various initiatives and programs for suicide awareness are working, Howard notes that there's a big issue that needs to be resolved before we can double down on these efforts. We don't know exactly what's been working. It's possible that the cause is a veteran-specific program, because their suicide rates are dropping at the same time that the total U.S. population's numbers are slightly increasing.
There is some evidence out there. There was a study published a couple of years ago in the American Journal of Preventive Medicine that looked at veterans calling into the Veterans Crisis Line. And what it showed was a very big reduction in suicidal ideation for those calls.
The Veterans Crisis Line launched in 2007, but recently became integrated with the National 988 Suicide and Crisis Lifeline. This initiative simplified access to care by allowing veterans to dial 988, then press 1 to speak with a VCL-specific responder. Todd Burnett, the acting executive director for the VA's Office of Suicide Prevention, says this campaign has significantly increased the number of people contacting the crisis line. In 2024, the VCL experienced 39% more calls than the previous year.
It's not more people are suddenly in distress. It's more people are actually connecting to care who've been in distress, but maybe trying to do that alone. When you think about crisis line services, obviously we have crisis responders, men and women who are incredibly talented, incredibly compassionate, and want to help people in the time of need. Our average response time, so we had 1.2 million calls last year, and we still answered that line within 8 seconds. When you think of the national standard for that's 20 to 30 seconds, we're still answering that within 8 seconds, and your average encounter with them is about 40 minutes long. And these people then get connected to whatever resources they need to help save a life.
And again, the crisis line is just one of many solutions put forth to reduce veteran suicides. While this program has proven to be life-saving, a main pillar of the VA's mission is to provide resources and support before someone is ever in a crisis situation. They've been using an effort called Risk ID to help identify veterans who may be at a higher risk of attempting suicide.
There are characteristics or traits that you can look at that help anticipate or project risk for suicide. And when you look at someone's entire medical record and you put all these factors together, you can actually predict people who are going to be at highest risk for that and then proactively work to engage them.
Burnett says they'll reach out to see what struggles these veterans are having and figure out what type of support is needed. These services go far beyond mental health support and suicide prevention programs because there are many other drivers of suicide that stem from issues like homelessness and insomnia.
Other common drivers for suicide risk are things like pain, which is common in the U.S. population, and about 20%, 24% of the U.S. population struggles with pain. But when you talk about veterans, that rate is almost twice as high, that they struggle with chronic pain or things like insomnia or traumatic brain injuries or those sorts of things. And so we can identify people who are at risk, who may have not only those things, but other factors that present some challenges for them that may elevate their risk, and get close to them, help push resources to them, email or text them with, hey, did you know, kind of resources for their caregivers or family members, and resources for community members that might be around those veterans to help connect. So we're not just going at the veteran, we go to their support networks and the communities around them to try and kind of make those resources and conversations as open and as accessible as possible.
Creating connections is another main pillar of the VA's suicide prevention. Burnett says that over the last 2 decades, a majority of veterans who took their own lives did not have any contact with VA resources.
It's been around 60% of veterans who die by suicide have not had any contact with VA for any services whatsoever, either in the year of or year prior to their death by suicide. That rate has gone as high as 73% back a few years ago. Congress has done some wonderful things to help address that, and by opening up, making it much easier to get connected to VHA care. And so you've seen some of the fruit of that, which has lowered it from 73% down to 60, but that's still way too high. That 60 to 73% of veterans who die by suicide, I never had the opportunity to help because they didn't come for help. That's where we need to make a change, and that's where I need everyone's help in doing that.
Burnett is a firm believer that the suicide crisis requires all hands on deck, which is why the VA has partnered with various medical, religious, and social programs across the nation.
You see us doing a lot with partnering with faith-based organizations, as well as vet centers and other community organizations that are often the first places that a veteran in distress may go for supports, because we want to help them be equipped so that when that veteran comes to them, there's no wrong door, that veteran can get connected from wherever they go to whatever they need. If a veteran doesn't want to come to us, that's okay. We want to help connect them to whatever resources they need from whomever they want to receive it. So you see us doing a lot of education and resource pushes to community providers who might come into contact with veterans, so that if that veteran wants to get connected with them, those providers know how to help get those veterans the benefits they deserve and the supports that they need. And so we're doing both an outreach directly to veterans, as well as a lot of push to their support networks to make sure they feel equipped.
One service working towards this goal is the Staff Sergeant Parker Gordon Fox Suicide Prevention Grants Program. It provides resources to community organizations that are filling in the gaps where the VA can't yet reach.
And these are grants that we give to community organizations, often in areas where veterans are challenged to be able to get to services. Either they don't have a VA option close to them, or they just don't have many options, period. Or they do, but they don't feel comfortable connecting to them. And so we have these collaborations with local community-based organizations to help provide connections not only to veterans and service members, but to their families. So if a veteran's family member who's struggling comes in, that impacts the veteran. And so the better that family does, the better the veteran does.
Burnett estimates that this service will double in size in 2026 due to Congress allocating more funds to expand the program. So whether it's direct contact or community-based outreach, the VA has numerous initiatives working towards ending veteran suicide.
The message there is we have help for whatever you're challenged with. Either we can help you with it directly through VA, or we can help connect you to a community partner. We can connect you to whatever those answers are. Suicide is not an inevitable outcome. Sometimes people, when they face things that are challenging, whether it's a traumatic brain injury or a trauma, or they're struggling with substance use issues, or they've lost a job, or there's marriage or something is struggling, you can feel overwhelmed, you can feel hopeless, but there's a way to navigate forward.
So while we don't yet know which specific programs are having the most impact on the recent downward trend, both Burnett and Howard believe we need to keep up the current efforts until researchers are able to pinpoint which initiatives to pour more resources into. Visit va.gov/reach for more resources. You can find more information about Todd Burnett, Jeffrey Howard, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zavari. I'm Elizabeth Westfield.